Our mission is to provide preventative programs and services to children and families in our community that are strength-based and promote healthy family development. With these two philosophical approaches at the forefront of everything that we do in supporting the participatory approach to program delivery, we work very closely with program participants to provide the support they feel they need. The food costing project was clearly a fit with our mandate, and we witness the effects of food insecurity every day with families that come to not only our center, but to other centers and organizations in our community. Memory Lane Family Place has been involved with the food costing project for the past 10 years. And the project was initially presented at a local gathering, and we immediately were drawn not only to the principles, but to the opportunities for program participant involvement. Members from our Parent Advisory Committee were willing participants and eagerly awaited opportunities to become involved and share the messages of data collection results with others in our community. And over the past 10 years, we've been able to demonstrate the key messages of partnership involvement by offering our facility for training sessions for food costers, by participating in food costing activities and testing the revised food costing tool and sharing experiences. These activities enhance the work of the CAPC project. There's been a higher concentration for us on cooking programs. We've developed a clothing depot as well as a swap shop. And also looking at healthy living programs and nutrition workshops on a regular basis. At the same time, capacities of program participants and staff have been enhanced. Results have been a combination of overall capacity building, awareness creation, and education around the issue of food insecurity. Collaborating on the food costing project is a partnership initiative that allows groups such as ours to give a voice to families, and especially those families who may be experiencing food insecurity. Our center's activities and parent committee have been more than willing to accept the new learning opportunities to become involved in the food costing project. Committee members did data collection training, preparing them to do the food costing in local stores. This experience proved to be a valuable learning experience for them all, and they're involved and they continue to do good work, and we applaud them for their efforts. As a community-based nonprofit organization, our commitment is to the families who live in our community and who participate in programs and services offered from our centers. This commitment isn't much different from any other organization or agency that are committed to working with families. We feel very fortunate to have the opportunity to work with other community-based organizations to promote family well-being, and in particular the food costing project. It's our intent to continue this work, and especially supporting our food costers and making our facility available for any regional training. We would like to raise a challenge to all of the family resource programs and to all of you to get involved so that we may influence public policy on behalf of our most vulnerable populations. They deserve the opportunity to access a basic, affordable, healthy, nutritious diet. Again, we would like to thank, on behalf of our organization, having the opportunity to be involved in the food costing experience, and also to have the privilege of being part of it on behalf of the families and children that we service in our communities. Thank you.
Thank you, Patty. Thank you, Jacqueline, and thank you, Beth. We have a few minutes before we conclude and can move to the next phase in our morning's program. The panelists have agreed to field some questions. So if anyone has a question to pose to one of the panelists, you're welcome to do so. Yes.
I have a question for Jacqueline. I guess I'm wondering if you could tell us a little bit about how your experience as a food coster has been. I'm not sure how long you participated, but how you found that experience.
Well, I've been a food coster for 5 years now, and I found it very helpful. Going to the stores and costing everything to see how much it would actually cost, and looking for, the better buy, because your no-name items are a lot cheaper than your brand items, and just to look, just to see and prepare, like which stores have good sales on and everything. another thing too, if you happen to know, is like Sobeys does it, buy one get one free. A lot of times, I don't know if you know, it's not, but they mark up their prices on their things, so you're actually not getting the item for free. For buying fruit and everything, when you buy apples in a bag, and if you buy oranges in a bag, actually, if you buy them loose, it costs less. And a lot of times, if you have families that don't eat a lot of fruit and vegetables, and you just only need a couple here and there, it's a lot cheaper to buy them that way. And if you do buy them by the bag, you don't know, you might get some that are gone bad or bruised, so you're not sure, but it is a better buy to buy them loose. It costs a lot less too. For me to do the food costing part, like it does, like when I go grocery shopping, I look for the better buys, and sometimes I'll take a calculator with me, and I will add everything up, so I won't come in that situation that I may have came in before and have to return items. So that's another tip too. If people want to do that, it may be a great idea, because I know it helps me that way. And like I said, I was very honored to be asked to come here today to talk about my story and what it meant to me and how much it cost and everything. Like, it just surprises me, and like I imagine surprises everyone here, how much it costs for a family of 4 to eat healthy. Now, for my family, as a family of 6, just imagine how much more it would cost for my family to eat healthy. And right now, like, we're really, really struggling big time. So it's really hard. But if anybody has the opportunity to go through this process, to go through food costing, I really recommend it, because it is a really good experience. You will learn a lot.
There's a question way down the back.
Municipal, provincial, and federal government responsibility, but if we could focus on provincial government responsibility, what would be the single biggest thing you think makes a difference? And the second part of my question is a little bit more fact-based. Whether you've calculated for a family on income assistance, what's the gap? How much would they need in order to, province-wide, to close that gap between what they need and what they can afford right now?
Thanks, Claire. Difficult questions. Like as I said, there isn't. I don't think there is one sort of easy answer to that question as to what's going to work. I think it's looking across the system. If we're talking provincially, it's thinking about a comprehensive strategy that's going to ensure that all Nova Scotians are able to earn a living wage, and really start to think about income assistance and minimum wage in terms of a living wage. But that's not the only answer. There are always going to be people in our communities who, suffer from mental illness or other things that may prevent them from, meeting their basic needs, and so there needs to be other things within our system to look after, people and make sure they don't fall through the cracks. There needs to be better supports, in our communities, better access to healthy food. We know there's a huge problem just in terms of our local food systems. I mean, we've looked at one piece of the puzzle in terms of the affordability of a basic nutritious diet. There's many other aspects to the issue of food security as well, and having access to healthy, locally produced foods so that our communities are healthy